Welcome to my YouTube channel RX Form Academy. Today we are going to discuss the extended release dosage form or sustained release dosage forms. Both are used for the same kind of the products. Instead of immediate release of the drug and loss of action after a few hours, extended release products keep on releasing drug over an extended period of time. Action is sustained over a long duration of action, and the need for taking the medicines again and again is eliminated. And how it is done, we shall discuss all the techniques one by one. Some of the students find it difficult to understand and difficult to memorize, but here it is made easy for all of you to understand and remember and recall through this video whenever you want. First of all, the definition. We are going to define the extended release dosage forms. It is defined by US FDA as extended release dosage form is one that allows a reduction in dosing frequency required by conventional dosage forms like immediate release tablets or solutions. As you can see in the figure, that the immediate release multiple dosing, you see the drug concentration peaks and troughs many of the times and even out of the therapeutic window. But in case of extended release or sustained release product, it maintains a steady state concentration without multiple dosing. These are the contents to be discussed in today's video. The matrix erosion tablets, which are of two types, gum type matrix and polymeric tablet matrix, sustained release pellets, core tablets, prolonged action tablets, ion exchange products, osmotic extended release products, microcapsules, transdermal drug delivery systems, and implants and inserts. These are all types of the products which ensure sustained release of the drug and sustained effect over a longer period of time, and we will understand it in detail one by one, and all the details are taken from the book Biopharmaceutics and Pharmacokinetics by Leon Charger. But before discussing the techniques, let's briefly discuss about the things on the basis of which drugs may be considered for sustained release products. Number one, it exhibit neither very slow nor very fast rate of absorption or excretion, and number two, they are uniformly absorbed from the GIT, and number three, it is administered in small doses and it poses a good margin of safety. Drug should be safe enough so that the extended release fails due to any kind of the reason and drug releases in amount more than the expected, which is dose dumping we discussed in the last video. It should not pose any life-threatening problem to the patient, so the safety is very important. And number five, it is used in the treatment of chronic rather than acute conditions. You see, multiple dosing is the problem in case of chronic condition, and it is not the problem in case of any acute kind of the disease. So the number one is matrix erosion tablets. The matrix is an inert solid vehicle in which drug is uniformly suspended. Matrix may be formed by compressing or fusing the drug and matrix material. Generally, the drug is present in very small percentage so that the drug is protected well by matrix from dissolution, and if there is a less porous material, it will give a longer duration of action. Drug release from the matrix is achieved by making tablets or small beads. Matrix material is porous and it swells upon absorbing water, and drug diffuses out from the matrix. As you see in the figure, that drug is formulated inside the matrix, and when it comes in contact with the water, the drug diffuses out of the matrix slowly. There are two kinds of the matrix. The number one is gum type matrix material. As the name indicates, that the matrix is gummy in nature when it comes in contact with the water. So some excipients swell upon absorbing water and form a gel-like consistency called gum. Such kind of gum is viscous and does not disperse for hours, thus providing a natural barrier to the drug diffusion from the tablet. Sustaining the drug for hours until the drug is dissolved completely. The common gelling material are gelatin, methyl cellulose, V-gum, gum tragacanth, and alginic acid. These all are examples of the gum type matrix materials. These are the matrices. When come in contact with water, these form the gums. The other is polymeric matrix tablets. The polymeric matrix provides a rigid geometric surface for drug diffusion and drug releases at constant rate. An iron preparation in polymeric matrix tablet named Gradumet, the matrix reduces the exposure of irritant drug to the GIT mucosa. The figure you see, there is a blue colored drug dot forming in polymer. Polymer erodes slowly and drug releases slowly and the polymer is expelled unchanged in the feces. The polymers available for that matter are polyacrylate, methacrylate, polyester, ethyl vinyl acetate copolymer, EVA, also known as polyglycolide, polylactide, and silicone. You see, this is the figure, and you can see the polymer degradations of various types. On left side you see, if the polymer is water insoluble, it's letting the water in and very slowly, so drug goes out slowly. And on the right side you see matrix erodes slowly. Erosion means destruction or wearing, tearing away slowly and letting the drug out slowly. And in the bottom, the polymer swells, letting the water in, and drug becomes soluble and the solution goes out along with the water. Sustained release pellets. You see, pellets means small beads. These are formulated beads and aim to be filled inside the capsules. So sustained release drug product may be formulated in the form of small pellets or beads, which are further punched into a tablet or filled into the capsules. And the beads are prepared from the slurry of starch, sucrose, and lactose. The resulting small cores are called non-peril seeds. And then these seeds are coated with drug powder. Once the drug beads are prepared, they may be further coated with protective coating to make it sustained release. As in the figure, you can see the small beads of various colors are mixed. In this picture, you can see red colored enteric coated pellets and yellow colored extended release beads are mixed and filled inside a capsule. Enteric coated beads shall release the drug in intestines, and red colored udrigid coated beads shall be releasing the drug slowly over a longer period of time to maintain a steady state concentration. And the next type is prolonged action tablets. You know, prolonged release tablets are designed to release medication more slowly and evenly over a longer period of time. This is the difference of concept between the sustained release and prolonged release. A very little difference. Drug action can be prolonged by reducing the aqueous solubility of the drug so that the drug dissolves slowly for many hours. If drug is used in the form of salt, then it is readily soluble. Acid form or base form of the drug is usually less soluble than the corresponding salts. The drug may be granulated with an excipient to slow down the dissolution rate. The excipients used for the prolonged release preparations are stearic acid, castor wax, white wax, spermaceti oil. You see, these all are oily ingredients that slow down the dissolution of the tablet, but the drug release may be erratic due to the oily preparations. There is an example that the tablets are ceticoline and pyracetam tablets, prolonged release tablets. Ion exchange products are there. Such products involve an ion exchange resin complexed with anionic or cationic drug. As the name indicates, that there is some kind of ion exchange involved in it, and for that purpose resins are used. An anionic resin is negatively charged, so a cationic drug reacts with resin to form an insoluble non-absorbable drug resin complex. And if the resin is cationic, an anionic drug will be complexed with it. Inside GIT, cations like potassium and sodium replace the drug from resin and releasing the drug which is absorbed freely by GIT. The next kind of the technique is core tablet. This is actually a tablet within a tablet. The core is used for slow release component, and outside shell contains a rapid release dose of the drug. The formulation of core tablet requires two granulations. You see in the diagram a blue tablet which is a regular immediate release tablet, and there is a green colored prolonged release tablet hidden inside it. The colors are just to show the design. Different colors of the granulation may or may not be there, but this is the design and concept behind. This is a very interesting one. The core granulation is compressed lightly to form a loose core. The core material is surrounded by hydrophobic excipients to make it slow erosion core tablet so that the drug leaches out slowly over a prolonged period of time. This core is transferred to a second dicavity where a second granulation having the some additional ingredients is compressed further to form a final tablet. The composition of core may be waxy, gummy, or polymeric in nature. Core tablet is for the purpose of sustained action. After core tablets, this is the osmotic extended release products. First I will let you know why this image. This is a laser drilled hole inside a core. An osmotically expandable drug formulation is enclosed within a membrane. Water goes in through membrane via osmosis and dissolves the drug and comes out through the hole at constant release rate. Releasing a constant amount of drug per unit time by a push and pull system. This is a novel drug delivery system which is controlled by osmotically controlled device that drives a constant amount of water in and dissolves the drug out of the product by push and pull system. The system consists of a semi-permeable membrane and two-layer core of osmotic ingredient and active drug. Osmotic pressure builds up from the inside layer, pushing the drug out through a laser drilled orifice in the drug layer. This is the gastrointestinal therapeutic system called GITS. This is quoted by Sharjeel. Osmotic extended release products, going in more detail. This is a newer osmotic delivery system, L-Oros soft cap. L-Oros soft cap, it offers greater bioavailability of poorly soluble drugs by formulating the drug in soft gelatin core. The gelatin capsule is surrounded by barrier layer, which is the release rate controlling membrane, and the delivery orifice is formed by three outer layers, not the gelatin shell. Let's study it in detail. L-Oros soft cap with enhanced bioavailability of poor solubility drugs by formulating the drug in soft gelatin core, providing extended delivery via an orifice drilled into an osmotic driven shell. Water permeates through the membrane and activates the osmotic engine. As the engine expands, hydrostatic pressure inside the system builds up, forcing the drug out via the hydrated gelatin capsule shell. When all the drug is squeezed out, gelatin capsule becomes flat. The osmotic layer located between the rate controlling membrane and gelatin membrane is the driving force for pumping the liquid formulation out of the system. This is the driving force, as I already told you, that this is an expandable osmotic layer. Other technique is microencapsulation. As the name suggests, that the drug is capsulated on micro level. So the microcapsules are formed, but the precise definition is process of encapsulating microscopic drug particles with a special coating material, making the drug particles more desirable physically and chemically in characteristics. Inside the diagram, you see that these are the microcapsules. Microcapsules may be of two types. The drug is inside the polymer layer, or it is like a razor wire inside the polymer layer. Microcapsules are of various types. It's a vast topic, and this is not a single technique, maybe or not. The microcapsules are developed through various methods, but it's a big science in itself. I shall make a separate video on this topic, so I am just giving you a definition and overview at the moment to describe that this is the part of extended release technology. The microcapsules of acetaminophen, ibuprofen and aspirin, these are available. These are examples. And microencapsulation is done basically to mask the bitter taste of the drug and to increase the flow and release characteristics of the drug. How it is changing the release characteristics, it will be discussed in a separate video very soon. You keep on watching. The next technology is transdermal drug delivery systems. Maybe you have studied it earlier. It's TDDS, or patch, is defined as a drug delivery system which is intended for delivering the dose of medication through skin for systemic absorption, not for the topical application to the skin, but for the systemic absorption through the skin. It delivers the drug through the skin in a controlled manner over an extended period of time. You see, this is why this is a part of sustained release topic. Examples are nitroglycerin patch, which is used for the angina patients, and nicotine patch, Nicoderm, used for the smokers who are trying to quit the smoking habit, and there is a need to overcome the craving for smoking. The transdermal products vary in design, but mostly consists of number one, a razor wire layer. Razor wire means a drug layer. Backing strip, a semi-permeable membrane on drug reservoir, a pressure sensitive adhesive, and at the end a protective strip which is removed before application. You see, this is the schematic diagram showing how the drug is passing through the layers of the skin. First, it is released from the patch and it has to pass through all the layers one by one till it reaches the subcutaneous tissue, which is the fatty layer here, and it limits the absorption of water soluble drug, but the fat soluble drug will be passing easily, still in controlled manner. Another video in full detail, but this is the basic one to tell you how it is included in controlled release or extended release category. This is the figure, a picture on your screen. This is the patch before application. It's being removed from the protective strip, which is like a paper which is held in the lower hand, and it will be thrown away. But the real patch is in upper hand. You see, it's a drug razor wire on the backing strip covered with a semi-permeable membrane for release of the drug. And over the next extended release products are implants and inserts. Some devices are made to be implanted inside the skin. A polymeric drug implant can deliver and sustain the drug levels inside the body over an extended period of time. You see, this is the lever plant. This is the birth control implant. In fact, any of the biodegradable and non-biodegradable polymer can be used to impregnate the drug over it. Levonorgestrel implants, Norplant system for subdermal plants, and other example is doxycycline hyclate delivery system, Atrigel, subgingival control release system for the treatment of periodontitis. Periodontitis is what it is, a soft tissue infection around the teeth, and it is treated via this antibiotic doxycycline hyclate, and its implant is made. Again, this is an example taken from the book Biopharmaceutics and Pharmacokinetics by Leon Sharjal. If you want to study yourself, you can go study that book, but it is an audio visual presentation in form of video. My channel RX Pharm Academy is bringing to you. You can memorize the things directly from here in easy way and recall it again and again whenever you want. For that matter, you have to like this video and subscribe the channel, and I shall be there with another important topic next time. You keep on suggesting the topics you want me to bring to you. Until next time, goodbye.